data. Dr. Morgan, among the biased information these hospitals are using is a kidney function calculation, which presumes that Black patients have more muscle mass, which can cause delays in care. There's a lung health formula, which uses 19th century research that suggests that Black patients have a lower lung capacity. And then there's a scoring index for determining whether a person can have a vaginal birth after a C-section that gives Black and Hispanic patients a lower success rate. So how do biased data points like these affect patients' treatment?
I mean, you hit the nail right on the head. What you're talking about with the kidney function is something called eGFR, estimated glomerular filtration rate. It's what we use to do an assessment of your kidney function. And that's incredibly important because that number can determine whether or not you're eligible for a transplant, when you should be referred for specialty care, when you may be referred for dialysis, which medications you should be on, and when you should start them. So can make your kidney function appear better than it really is, and therefore delay needed and specialty care that you may need to have. We see that as well with lung capacity when we look at spirometry. And that in particular is troublesome because a lot of those calculations are built into the software, and physicians are even unaware that that race calculation is being used in the software when we look at lung capacity. And that is incredibly important as we are in the middle of this COVID surge, as we continue to fight variants, and people certainly can have pulmonary issues. We want to make certain that everybody gets the absolute best care.
Help us understand where this information comes from. As I understand it, it comes from clinical research, but clinical trials have historically contributed to this problem because they don't tend to have enough people of color involved in them.
Certainly, there's some historical context to that, and we know that things that were done in the name of research, and I'm saying research in quotation marks, from 50, 100, 150 years ago, often began with false premises, and then that was carried on. So for instance, if we look at the lung capacity, one of the justifications that was used is that body proportions are different in the Black race and the white race. And therefore, they put this race factor in that decreases your lung capacity automatically for a specific race. And while we recognize that individual proportions may be different, things also can be related to occupational and social determinants of health, and all proportions are not certainly race-based. And so if those calculations are going to be done, they need to be done on an individual basis and not using race as a proxy in these formulations and in this software.